Today we are going to do a PRP breast lift. So I have already drawn my patient's blood, spun it down into these handy dandy little syringes. I have numbed up our patient's chest, and we're going to go ahead and inject the PRP, and then we're going to inject the PPP, or platelet-poor plasma, in the other areas of her breast. Because we have all of this serum, so we might as well use it. And any little platelets that might be left behind in the platelet-poor plasma will give us a benefit wherever we inject it. So I'm going to go ahead and start. So I've already numbed and cleansed and antiseptic. I don't know if that's the right word. Wait, have you turn your head away? Yep, you got it. Okay, so we're going to start right over here. 1, 2, 3, la la la. Here we are. And so platelet-rich plasma stands for, or PRP stands for platelet-rich plasma. And as I said, we get platelet-rich plasma by drawing our patient's blood and spinning it down. And we actually use a 2-spin centrifuge, so we really get very, very concentrated platelets. And centrifuges matter because some centrifuges are just 1 spin, and I think you just get you get more concentration when you can double spin. And we're going to, you can already see how much fullness we got just in this little area. And I'm gonna just push on it a little bit. And we're gonna do the next step. We're gonna go a little higher. Okay. And just rub this a little bit. You okay? Mm-hmm. Okay, so we're gonna go up here now. 1, 2, 3, la la la. Here we go. So, and you're doing so great. It's so easy. And so it can take anywhere from 2 months to 6 months to see the total full result of this. And I tell people, come back in about a year and let's redo it. You know, depending on how long it lasts for you. It can last for a year, it can last longer. You're doing great. And this is not like filler where you need to be exact on where you put it, other than these areas of where we have deficiency. There we go. Okay. Okay. Now we're going to take the platelet-poor plasma. 1, 2, 3. You got it. And we draw about 120 cc's of blood for this procedure. It sounds like a lot, but it's less than half of what they use when you give blood for donation. So. You doing okay? Awesome. And you could use PRP for any number of reasons. One of them, of course, being the breast lift. You can inject into the scalp for hair restoration. You can inject it into the face as well for PRP face lift. You can microneedle it into the face, and that's called the PRP facial or vampire facial. So you can use it also to help with sexual wellness. So you can inject into the private areas of women and men. There we go. Okay. One more little tiny spot, okay? You got this. You're doing really, really well. 1, 2, 3. You know, sometimes these are a little spicy. And you got it. So afterwards, you're going to want to wear like 1 or 2 sports bras especially if you're gonna work out, I would recommend wearing 2 sports bras. Just because it helps have the girls high and tight. High and tight. Okay. And now we talked about going under the nipples, so we'll go 1, 2, 3, low, 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 low. Low, low. Mm-hmm. 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 You got it. You're doing so good. So good. I'm gonna go under the nipple this other direction too. Is that okay? Yep. Okay. Okay, you got it. You got it. So good. You're doing awesome. Mm-hmm. Mm-hmm. Great. So good job. We finished the first breast. How do you feel?
Just fine.
Okay, good. Happy that we're done with one. Look at the nice difference already in the cleavage.